Anybody identifying with any of the symptoms so far? So let's talk about adrenal hormone imbalance. It can cause digestive symptoms if you don't have enough adrenal hormone or too much, like indigestion, low hydrochloric acid production in the stomach. So you have trouble making enough hydrochloric acid, which means you don't digest protein, and you eventually don't digest other foods because of the downstream effect. Heartburn, diarrhea, or constipation, otherwise known as irritable bowel. Slow growth and healing. There's actually a condition called stress dwarfism in children, where children do not grow if they've been subjected to extreme stressors. That's because, remember, that cortisol, that stress hormone, actually suppresses growth hormones. They stop growing. Poor wound healing. So when you cut yourself, it just doesn't seem to heal. Rashes, hives, and acne, really common. And rapid aging. Remember way back at the beginning of the seminar, we talked about telomeres and how telomeres shorten when you've been under extreme stress. Look at our presidents. So look at Bush from 2001 to 2009. Look at Obama in 1 year. And look at Ronald Reagan from 81 to 89. You can see it in their faces. You can see it in their hair. Extreme stress. I can't imagine a more stressful job. Whenever I think my job is stressful, I think, at least I'm not a Barack Obama, you know? Brain problems. So remember we talked about how long-term stress hormone to the brain can actually lower serotonin. It can also lower GABA. GABA is your anti-anxiety neurotransmitter. So if you've been under long-term stress, you can end up with anxiety from having low GABA. Also low dopamine, which can cause trouble focusing, trouble thinking, addictions, which can worsen in people under chronic stress. And inflammation and immune problems. Remember that if your cortisol is low because it's been high long term or it's inadequate, you can end up with lots of inflammation because that's the main anti-inflammatory hormone. So that can contribute to pain, fibromyalgia, heart disease, diabetes, Alzheimer's, osteoporosis, allergies, frequent infections, autoimmune disease, and even some forms of cancer. So very important to have stress hormone balance to prevent those things. And if you're running away from the tiger and you've been stressed long term, you're not going to want to make sex hormones because your body is smart and it doesn't want to reproduce. That can lead to infertility. It can lead to PMS or menstrual problems or worsening of menopausal symptoms. Sometimes I won't even change a prescription on a patient, but they come back in and they're having terrible symptoms again and the prescription hasn't changed, and it's because they've been under extreme stress. Low testosterone, low libido. So a man, if he's on testosterone and he's under extreme stress, the testosterone often won't work. It won't have the same effect. We already went over weight gain and how that happens with adrenal hormone imbalance, because stress increases your appetite. It increases your carbohydrate cravings, your blood sugar, and your insulin, which leads to the belly fat gain and the new formation of fat cells. So you actually get more fat cells under a lot of stress. And it reduces your ability to mobilize that fat, reduces thyroid hormone function, and then your two anabolic steroids, testosterone and growth hormone.